Why do drugs sometimes have opposite effects in individuals? Imagine taking the same medication as your friend and experiencing completely different results. One feels relief, while the other feels worse. Why does this happen? It all comes down to how our bodies handle drugs and how our bodies respond to them. When we talk about drugs working differently in people, we are looking at two main areas: pharmacokinetics and pharmacodynamics. Pharmacokinetics is about how the drug moves through your body. It involves absorption, distribution, metabolism, and elimination. Your genes play a big role here. For example, some people have genetic differences in enzymes that break down drugs, like the cytochrome P450 family. If someone has a version of this enzyme that works too fast, they might clear the drug quickly and not get enough effect. If it works too slow, the drug can build up and cause side effects. Take codeine, for example. It needs to be converted into morphine by an enzyme called CYP2D6. If someone has a slow version of this enzyme, they might not get enough pain relief. But if they have a very fast version, they could get too much morphine and experience toxicity. Now, pharmacodynamics is about how the drug interacts with your body. This involves receptors or enzymes that the drug targets. Genetic differences can change how sensitive these targets are. For instance, some people have more or fewer receptors, or their receptors work differently. So, a drug might act as an agonist, activating the receptor in one person, but in another, the receptor might not respond as strongly or might even block the effect. Cellular differences also matter. Cells in different tissues can express different levels of receptors or transporters, affecting how the drug reaches its target. Plus, environmental factors like age, diet, liver and kidney health, other medications, smoking, and alcohol use can all change how drugs work. For example, older adults often process drugs more slowly, which can change the effects. In medical school, understanding these differences is key. It helps future doctors predict why some patients respond differently and guides personalized treatment plans. This is the foundation of pharmacogenetics and pharmacogenomics, which aim to match drugs to a person's genetic makeup for better results. In real life, doctors start with standard doses but watch how each patient responds. They adjust doses or switch medications if needed. So, the reason drugs sometimes have opposite effects is because of a mix of genetics, cellular differences, and lifestyle factors that influence how drugs are processed and how they act. Recognizing these factors helps us understand why medicine is not one size fits all and why personalized care is so important.